Hello, my name is Bethany Suey, and I decided to do my presentation on a device called the Cerebrotech Visor. This presentation is important to me mainly because I have the opportunity to work in a comprehensive stroke center where mechanical thrombectomies are performed by interventional radiologists. As a nurse, we always educate patients on the symptoms consistent of a stroke and the importance of getting to the hospital as soon as possible. As a healthcare professional, it is important to understand the types of strokes and the different treatment options for both ischemic strokes, large vessel occlusions, as well as hemorrhagic strokes. When a patient develops symptoms of a stroke, such as weakness in the body, slurred speech, facial droop, and confusion, the utmost and crucial factor is time. The Cerebrotech Visor is a non-invasive bioimpedance spectroscopy device that detects changes in distribution of cerebral fluids. The Cerebrotech Visor can detect pathologies such as stroke, trauma, and swelling. When placed on a patient's head, the visor emits low-energy frequency waves through the hemispheres of the brain. As the waves pass through the brain's fluid, the frequencies change. The visor is then able to detect the changes in frequencies between the two hemispheres of the brain. If the frequencies are drastically different, they indicate the occurrence of a stroke. Also, the greater the difference, the greater the stroke severity. This is when you would see the difference of a large vessel occlusion versus small vessel occlusion. The Cerebrotech Visor has many benefits and is mainly used in patients requiring mechanical thrombectomy. However, research and study trials are still ongoing and have been studied in cases of trauma as well. According to the Cleveland Clinic, there have been trials investigating the effectiveness of diagnosing hemorrhagic strokes. The Cleveland Clinic research studies showed that the Cerebrotech Visor has a 92% accuracy rate in identifying patients who have suffered a major stroke, such as a large vessel occlusion. At the time of research and development, the Cerebrotech does not replace any method of treatments, but in addition to common stroke protocols, can provide quicker detection of large vessel occlusions and other types of strokes, which is believed to have better patient outcomes. The main benefit of the visor is the earlier intervention in stroke patients. The visor has also proven useful for pre-hospital personnel such as EMTs and paramedics. The correct diagnosis of patients having a stroke by pre-hospital personnel can be anywhere from 40 to 89%, and that's not including the visor. Allowing pre-hospital emergency responders to have the visor would allow for 92% accuracy and will ensure the patient gets to a comprehensive stroke center for best possible intervention. The visor can also be beneficial in the fact that doctors will have more definite answers of what type of stroke a patient is experiencing prior to waiting for a final read from a radiologist once a CAT scan is performed. The Cerebrotech Visor is estimated at approximately $55,760 American dollars. At this time, it is not accessible and is still being researched in clinical trials. Overall, the visor can be used in many different settings. Another important setting would be in nursing homes and rehabilitation centers, along with pre-hospital environments and hospital environments. The reading while using the visor takes less than 1 minute. The Cerebrotech Visor would be useful in rural areas where comprehensive stroke centers are not in close proximity. Overall, the crucial advancement can help medical professionals effectively diagnose patients having a stroke, particularly a stroke resulting from a large vessel occlusion, and will further help professionals provide interventions such as mechanical thrombectomy in a timely manner, resulting in less tissue damage and better outcomes for the patient.